families are being asked to look after elderly patients at home to free up hospital beds. Managers urged relatives to help ensure patients are discharged quickly, including collecting them and becoming familiar with their medication. The advice was issued at 3 hospital trusts in what has been described as the NHS's worst winter crisis since the 1990s. On Tuesday, hospitals were told to cancel up to 55,000 non-urgent operations to free beds and frontline staff amid a rise in flu cases. Yesterday, doctors say the conditions in A&E are the worst they have seen, and patients are being treated in corridors due to a bed shortage. The first week in January is normally very busy for hospitals, but this year many more patients are succumbing to severe chest infections and flu. Official figures today are expected to confirm there has been a surge in flu cases as well as an increase in A&E waiting times. But the pressures are likely to intensify later this week, with the return of freezing temperatures predicted across the UK. Experts are particularly worried about an aggressive flu strain, H3N2, responsible for Australia's worst flu epidemic in 50 years. The main reason A&E units are overcrowded is because hospital wards are extremely full, so anyone arriving to A&E who needs to be admitted must wait for hours on a trolley until a bed is free. Many of the patients occupying hospital beds are elderly and medically well enough to go home. But doctors cannot discharge them due to a lack of social care. Managers at Northampton General Hospital, Bedford Hospital and Western Sussex hospitals have urged relatives to do what they can to help patients go home as quickly as possible. The alerts over the past 2 days were endorsed by NHS England. A spokesman said relatives could give patients a lift home, making a bed available up to 4 hours earlier than if they were sent home on hospital transport or in a taxi. The NHS England spokesman encouraged relatives to speak to their loved one's doctor and familiarise themselves with all the patient's medication. Bedford Hospital put an urgent public notice on its website yesterday that it was extremely busy. It added, "We ask that relatives support us and their loved ones by helping us discharge patients that are medically well to return to the most appropriate environments such as their own home or a community care home." A spokesman urged relatives to give up their time to cook meals and visit. Western Sussex Hospital sent out a reminder on Monday, having begun a campaign last month asking families to help get patients out of hospital. A spokesman said relatives could help by allowing them to move into spare rooms. AGEUK's Caroline Abrahams warned this was no substitute for the social care service that many older people require. Yesterday, 16 hospital trusts said they were on the highest alert, meaning patient safety is at risk, and managers are turning to contingency plans such as drafting in extra staff and diverting ambulances. The total number is likely to be higher as many refuse to confirm their status. Dr. Adrian Harrop, a senior A&E doctor at Scarborough and York hospitals, said patients were waiting for a full day, adding, "That's the worst I've seen." Jackie Weaver said her elderly father, who has dementia, was made to languish on a trolley for 36 hours at the Royal Stoke Hospital. Jeremy Hunt said, "If you are someone whose operation has been delayed, I don't belittle that. I apologize to everyone who that has happened to. My surgery was cancelled as the taxi to the hospital waited outside. The taxi ordered to take Joan Myers to hospital for her knee replacement was waiting outside her house when the phone rang. It was the hospital to say her operation had been cancelled again. Mrs. Myers, 79, had been waiting since September for the surgery. It's appalling, the grandmother said yesterday. This isn't just about numbers, this is real people's lives which are being affected. My husband and I are keen walkers. We used to love going to the Lake District, but these days I struggle to move around the house. Mrs. Myers, from Romiley, Greater Manchester, was booked in at Stepping Hill Hospital in Stockport at 11 a.m. yesterday, but was called an hour before her appointment to say it had been cancelled. Instead, she has been offered a date next week, but is skeptical as to whether things will have improved in time. She said, "If things are this bad at the moment, who's to say it will be any better next Monday?" The retired primary school teacher, whose husband Arthur, 80, is a retired engineer, said her operation was first cancelled last month due to the surgeon being ill. "My husband had one hip replaced on the NHS in 1984 and the other in 2005, and both times it was perfectly straightforward," she said. "I just don't know what's happening." Grandfather left lying in corridor for 10 hours after fallen care. A grandfather of 6 was left lying in a hospital corridor on a line of stretchers for 10 hours after he had a fall at his care home. Alzheimer's sufferer Derek Thomas, 81, had a suspected head injury and needed a CT scan when he was taken to the Princess Alexandra Hospital, Harlow, Essex, on December 27. Mr. Thomas, who lives in a care home in Hartford, arrived at 10:30 p.m. by ambulance but was not taken for his scan until 4 a.m. and it was only when his son Colin jazzed up doctors arriving on the morning shift that he was given his test results and the all clear to go home. His father, a retired retail worker, then had another accident on Friday evening and had to wait 5 hours for an ambulance. When they finally arrived, paramedics said he did not need hospital treatment. Colin Thomas, an architectural engineer, 56, said, "I must have been in this situation at least half a dozen times, and it's never quick." "We've never waited in corridors like that before. We've always been admitted to one of those small rooms where you get examined." The married father of 2, from Ware, Hertfordshire, added, "It's not the hospital's fault." "You can see the pressure they are under. The staff are as embarrassed as we are,